Hi, I'm Dr. Ekberg, and I'm sitting here with Scott Henderson. We'd just like to chat for a few minutes and share some things that you might find some benefit in. So Scott, you want to tell us why you came in the first place?
Sure. About 9 months ago, I had some severe pain in the middle of my back on the left side, and probably lasting a couple weeks, and just wasn't getting any relief from it. And so I actually found you on the internet, and was really impressed with what I saw. And so I decided to give you a try, and I came in, and things have gone really well as a result of that. My back pain isn't there at all anymore. I'm able to do the things that I feel like I want to do, work in the yard, lift heavy things in the yard, just all the sorts of things that I have always done, and I'm back to being able to do that.
Wonderful.
So
Did you try anything else before that?
Yeah, well, I tried putting ice on my back. I tried just taking it easy, and I was getting concerned because it didn't seem like it was getting any better no matter what I tried.
Okay.
So
All right. Well, I'm glad that we could be of help with that. I wanted to mention something else also that we worked with a little bit later, because then that you said that you also had heartburn or reflux.
yes.
And so we got you some supplements, and how has that been working out?
Really well, better than I imagined it would. That was one of the things I mentioned to you just sort of off the cuff when I was in here, and unexpectedly have had a good deal of favorable results from the course that you recommended. Both the dealing with it from an adjustment point of view, as well as the recommendation you made of particular supplements. I struggled with this for 15 years, and had been taking numerous types of prescription. I started off with prescription medications, the proton pump inhibitors, and then I decided, I thought I was getting better, and so I decided to lay off of that, and then it would come back, and so I took the over-the-counter stuff like Zantac and Pepsid and those sorts of things, and I was having to take those every day, and I thought, this can't be good.
Yeah.
And so when I mentioned that to you, you ran through a number of tests, the strength tests that you do, and so on, and you recommended a particular course and the supplements. I'll tell you, what was surprising to me was how quickly those supplements worked. With the very day I started taking them, that night I went to bed wondering what was going to happen, because if I didn't take the Zantac before I go to bed, I'd wake up the next day and it felt like someone ran a wire brush up and down my esophagus. Some not all the time, but sometimes that's how it would be. And so the next day I got up, I couldn't believe how good I felt. And so I've been taking them ever since, and been extremely pleased with that.
Wonderful.
Yeah.
A little side note for those who aren't familiar with the mechanisms here, that most people and most of the traditional belief in our healthcare system is that heartburn and reflux comes from too much stomach acid, when in fact it develops because of not enough stomach acid. And first we have to understand that the body doesn't do anything by mistake, that if the body makes hydrochloric acid, there's a reason for it. So your body makes hydrochloric acid in the stomach to digest proteins, and if you don't digest proteins properly, you missed one of the most important steps of digestion, and now first of all the food sits around too long and it starts wreaking havoc, and secondary acids are forming, which actually creates the reflux. But furthermore, undigested materials go down through your digestive system, and now you get inflammation and irritation further down. And the traditional way then with proton inhibitors and TUMs and all those things, they're trying to neutralize the acid that the body is making on purpose. So now you're digesting food even to an even lesser degree, and now you have malabsorption and nutritional deficiencies because the food you're eating isn't getting digested. So what's exciting about this is that not only are the symptoms going away, but you're actually getting more nutrition out of your food.
Yes.
And that's just a bonus.
And I feel
So-
better overall. And if this isn't TMI, I have more regular bowel movements, and I know exactly when they're going to happen every day.
Yeah.
So that's
And-
all good.
And that's important stuff.
Yeah.
We don't talk about it, but that's some of the most important basic functions of the body.
Yes.
Yeah. Well, wonderful. Thank you so much for sharing.
My pleasure.
And
Happy to do
we
it.
hope continued success.
Thanks.
Thank you.